Hi, it's Dr. Osborn, board-certified neurosurgeon. So many of us as we age suffer from hip pain that is often associated with low back pain. These two are often confused, in fact, making them troublesome for physicians to treat. Orthopedic surgeons are attributing the patient's pain to their low backs, while neurosurgeons are doing just the opposite, attributing the patient's pain to their hips. And often they're both right, a little back and a little hip. So what's the solution? Well, treat both with simple strengthening and mobility exercises daily, and you won't have either to worry about. So I talked about a great exercise for low back strengthening in another video. In this video, I'm going to give you one movement for your hips that you can use every day to mobilize them and mitigate aches and pains that occur mostly due to immobility or our relatively sedentary lifestyles. Now, this movement will be uncomfortable at first, but if you just work at it, if you persist, it will pay massive dividends. And not only in regard to your hip pain, but also your low back pain. Go figure. We teach everyone that comes to train with us the same movement, and that's the static hold squat. The static hold squat is going to require you to keep your torso either flat or even in a slightly extended lordotic position. I'm going to show you how to do it, and it's very, very simple. You start off on a box. So here's what we're going to do. Slightly wider than shoulder width, maybe about 1.5 times shoulder width actually. First thing that you're going to do, and I'll show you this from the side, is you're going to unhinge your hips. You unhinge your hips and you scoot your butt backwards. And as you're coming down, you are pulling yourself down using your hamstrings, and at the same time you're driving your knees out so that they stay in the same plane as the feet. Your goal is to, when you are seated finally, is to have vertical shins. That's going to offer me the best position of power if I'm coming out of the hole in a squat. I'm going to push plumb into the floor as I'm coming up, and I'm going to drive my hips forward. So let's do it again. Unhinge, knees out. I'm thinking about spreading the ground. Knees out, knees out, knees out, knees out, knees out. Vertical shins, vertical shins. Barely touch the box. So ultimately, what you're going to do is you're going to be able to squat and you're going to remove the box. And here's what I want you ultimately to be able to do. I want you to be able to do a 1 minute, and all it takes is 1 minute a day. 1 minute. And you're going to be down deep, 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 all the way down. Okay? And you're going to sit for a full minute. You should be perfectly comfortable sitting just like this. It shouldn't be any issue. Is it hard? Yeah, it takes time. You'll develop the low back strength, the buttock strength, and the hip mobility to do it though. So just keep practicing, you'll get it. If there was one movement from a mobility standpoint that you could do to confer total body flexibility, it'd be this movement. If you want to further train the movement, buy a hip belt and use it not only during your static holds, but also during your squat and deadlift sets. And kiss your hip and low back pain goodbye.